The reality of sudden infant death syndrome, or SIDS, can be any parent's worst nightmare, but experts say there are ways to reduce the risk. Our Ken McCoy has that story.
Parents with newborns can often be protective, but there is one danger that often goes unlooked, and that's because there is no real way to detect it.
So anytime an infant dies less than a year of age, whether it's a known or unknown cause, it's called a sudden unexplained infant death, or a SUID. So a SIDS death, and that's an older term, but a lot of people still know it as SIDS. It's if there's a child that's less than a year that dies and there's no known cause after a complete investigation, an autopsy, examination of the death scene, and medical review, it's called a SIDS death.
In 2020, the infant mortality rate of 7 deaths per 1,000 live births tied for the lowest rate in Alabama in more than 5 decades, but was higher than the U.S. average of 5.5.
Our infant mortality rate over the last few years is running about 7 or so deaths per 1,000 live births. And in terms of the rate of the SIDS deaths in the North Alabama region, they have been about the same as the other causes of death.
Some risk factors include smoking, drinking, or use drugs during pregnancy and after birth, poor prenatal care, infants were born prematurely, there's a family history of SIDS, and unsafe sleeping conditions. While it may be hard to detect SIDS, there are ways to prevent more cases.
Strongest recommendations for reducing any sort of sleep-related death is to place the infant on the back to sleep for every sleep, always on their back, to use breastfeeding if possible, avoiding smoke and nicotine exposure. All these things have been associated with higher rates of SIDS.
For more SIDS prevention tips, head over to fox54.com. In Huntsville, Ken McCoy, Fox 54 News.